Hey everyone, it's Jessica Guillermo, and this presentation is going to be giving you tips on giving medications. First, let's talk about what this presentation is and isn't about. This presentation is practical tips and suggestions for giving various medication orders and routes, as well as avoiding errors. It is not a comprehensive list of all medication types and orders. It will not cover rights of drug administration or common safety checks, as these are often covered during your regular curriculum. And finally, it does not cover medication administration tips for medications used in specialty settings such as ICU, OR, labor and delivery, and other specialties. Okay, so let's get started with some general tips. First, avoid distractions. Try not to talk to other people or do other patient care tasks while giving medications. Second, develop a routine. This could include how you determine which patient you do first, or how you collect the medications or give the medications. Developing a routine can help you avoid errors and forgetting things. Third, one patient at a time. It can be tempting to grab medications for more than one patient at a time so you have less trips back and forth. This, however, it can be dangerous and confusing. Fourth, ask if you are not sure. If you don't know what a medication is for, how to give it, what the interactions are, make sure you ask somebody else or find the appropriate reference. Fifth, check for interactions. A lot of nurses forget to do this, and a lot of times computers will do it for you. But an example of when a computer won't catch an interaction is when you're hanging a secondary IV line. Often secondary bags are hung off of primary bags, and sometimes the primary fluids don't actually interact well with the secondary fluid. An example of this is lactated ringers. Doesn't always go along with every single antibiotic that you're going to give. So make sure to check these interactions, and if you're not sure, a great place to call is the pharmacy. They'll know. Sixth, follow protocols. There are a lot of different protocols for giving medications. Some examples are when you're giving insulin, a sliding scale. How much insulin do you give for a certain value? Or if you're giving heparin via IV continuously, there's an extensive protocol usually on how much heparin and when to stop, increase, or decrease it. Make sure to follow these protocols to the letter, and if you have questions, ask somebody or even go ahead and ask the doctor. And finally, seventh, report errors. It can be scary, especially as a new nurse, to say, I made a mistake. But reporting an error early and consistently can help to make sure, first of all, the patient isn't in any danger. Second of all, to make sure they get any treatment they need for the error. And finally, it helps you and your hospital learn how this error occurred in order to prevent it in the future. Often, nurses have a lot of medications to pass in a short amount of time, and especially as new nurses, this can be overwhelming. So here are some tips for an efficient med pass. First and foremost, whenever I mention being efficient during your medicine pass, make sure you stay safe. You'll see a lot of nurses take shortcuts. Some of these are still safe, some aren't. Do not take unsafe shortcuts, and as a new nurse, I'd recommend not taking shortcuts. Second, look up your meds at the beginning of the shift or when a patient is transferring to you. Look them up then. That way you know when you're going to be giving meds and what type of meds and how many meds you're going to be giving throughout your shift. Third, have a plan. Which patient or med is going to be given at what time. Okay? Have a plan for what you're going to do for your med pass so that it's organized. Fourth, gather supplies. I can't tell you how many times I've been personally slowed down because I forgot the syringe for a certain medication, and then I have to go back to the central area in order to get that. Gather all your supplies. Take a moment to stop and think before you leave the med area and make sure you have everything you need. Fifth, vital signs. A lot of medications, let's say a blood pressure medication, require vital signs in order to give to make sure it's safe to give. My suggestion is to start these vital signs when you go in, and then go ahead and start scanning the medications while the vital sign machine is taking those signs. That way they're ready for you so you can determine whether or not that med is okay to be given, and you're not waiting for vital signs to be done. 6, scan and sign. Now, there are some people who will say you should not sign that you've given medications until the patient has taken them. There is merit in saying that. That being said, I've seen a lot of new nurses go ahead and scan all their medications and then have a patient who takes medications, let's say one pill at a time, and by the time they get back to the computer to sign, the computer has figured that they left it and they've cleared all of that, saying that they actually didn't give any medications. And then they have to go back through trying to find all the medications, all the wrappers, and scan again. This slows them down significantly. My personal suggestion is to scan all the medications and sign. If for some reason you aren't able to give the medication after that, go back, make a note, and correct that documentation right as soon as that occurs. When you're telling the patient what they're getting and what the side effects are and what the medication is for, try to do that while you're scanning medication. Go ahead and hits two birds, one stone. 8. Organize your med pass. This is what I'm talking about when you're actually in the room and going to be giving meds. If you're going back and forth, you give one oral med, then you hang an IV med, then you give an IM med, then you give another oral med, it's going to slow you down. So group them, give all your oral meds, then go over to the IV pump and hang all your IV medications that you can give. This can help speed up your med pass and still remain safe. 9. Assess the patient first prior to starting even your med pass. Sometimes you might not have time for this, but I find that it's helpful because let's say you go in the room and the patient's in a lot of pain. Then if you had all your medications, you'd have to pick all your medications back up, go back to the Omnicell or wherever you're getting your medications and get that medication and head back to the room. But if you already assessed them, you know when you gather the medications in the first place that you're going to need that medication as well. And finally, know your time window. Most medications in most hospitals will give you 1 hour prior to 1 hour after the due time for the medication to give that medication before it's considered either late or too early. Know these time windows. There are exceptions. For example, if you're pulling a controlled medication like a narcotic, I would not wait an hour to give that medication because who knows what could happen to that medication in the meantime. I see a lot of new nurses have questions and get confused with PRN medications. PRN medications are as needed medications. They can be for pain, for patient needs, for clinical signs, for lab values, for protocols. They must have a reason in their order. So if you have a Tylenol order, it must say what that Tylenol is for. If it's for pain, it must say for pain, rated 1 to 3. That's a reason. Now also remember that you only give a PRN medication for what it's ordered, for the reason it's ordered for. So let's go back to that Tylenol example. Tylenol is often ordered either for pain or for fever. If you have a Tylenol in your PRN medications that says for a temperature over a certain number, but your patient has a headache, you do not give that Tylenol to that patient for their headache. You would need to get a different order. Next, assess your patient. So when you're assessing your patient, ask them questions that indicate they might need one of the PRN medication orders that are ordered. So at the beginning of shift, when you're looking up your medications, go ahead and look at the PRN medications. It'll indicate to you what the patient might want or need during your shift, and when you're assessing them, you can ask that and go ahead and know what they need. Look for the indications. So similar to assessing your patient, some of your PRN medications might not be something the patient can tell you, but might be a lab value that comes in or a protocol. So for example, for this, let's say a lab value comes in that has a potassium that's low. You might have a PRN medication that also is part of a protocol that says between this amount and this amount, you give this much potassium supplementation. So look for those types of indications. Similarly, know your protocols. Know precisely when a PRN medication is needed in reference to a protocol. Also, no last administration. So a lot of times, let's say you have a narcotic and it says it can be given every 4 hours. You want to know when was this last given and when is it available again. That way you're not giving the patient too much of it, and the patient can also know when they can have it again if they're in pain. And finally, keep track. especially with medications who have side effects that are sedatives or pain medications or Tylenol. Keep track of how much and how often a patient is taking them. Don't just depend on the computer to do this, because sometimes there's multiple different orders that might have something like Tylenol in it that isn't actually called Tylenol. Make sure you're keeping track of that. A big fear of every new nurse, and honestly every nurse, is that they will make a medication error. Um, it happens, know that, and like I said, make sure to report it in any instance that it does occur. But here are some tips for avoiding medication errors. I told you in the beginning I would not be going over the 5 rights of administration, and I won't, but know these 5 rights of administration and follow them. Next, double check. Double check your procedures. Double check your protocols of administration. Read back. You hear this a lot probably from your instructors. If you're taking an order, especially over phone or spoken, make sure you read back. Ask them that this is exactly what they're ordering. Name alerts. Use a name alert if you have patients with similar names. There are a lot of patients who have similar last names and or first names. Make sure there are name alerts either on the boards or in the computer systems for those patients. Know your drug reference guide. Most computer systems in hospitals have drug reference guides, and these are where you can go to look up a specific drug, their interactions, their side effects. That way you know what you're giving and what could potentially happen with that medication. Don't take unsafe shortcuts. There's a lot of merit in saying don't take shortcuts at all, and as a new nurse, I certainly recommend that. If you ever are considering some form of a shortcut, make sure there is no danger to you or the patient, and if there's even a guess in your head that there could be, don't do it. Check for drug interactions. Check that drug reference guide or call the pharmacy if you're not sure. Give medications to one patient at a time. Don't do it for more than one, no matter how tempting it is. This is an unsafe shortcut. Check for drug allergies. Are they documented in the computer? Can you see them plainly? If not, ask the patient. And finally, ask questions. Ask questions of other nurses, of doctors, of managers, of pharmacy. If you're not sure, ask the question. It's better than making a medication error. That's it for now. Thank you for listening to me. I hope that this presentation helps to ease some of your worries about giving medications and gives you some tips for helping make efficient med passes. If you have any questions, always feel free that you can reach out to me. Here's my email and my phone number.